It's 2 o'clock.
Oh, there we go.
So, I'm Natasha. I'm the Executive Director of the Canadian Association of People Who Use Drugs, and the notice that this meeting is being recorded has just been put up. So we wanted to give anybody a chance to let us know if they don't want it recorded, if they have issues with that. They're all muted, so it's hard to tell. You can put it in the chat if you do. Okay.
And my name is Stephanie Lake. I'm going to be co-hosting with Natasha. I'm involved with Canadian Students for Sensible Drug Policy, or CSSDP. I'm a strategic advisor with them. CSSDP is a grassroots network of students and youth who are advocating for drug policy reform. We have chapters across Canada. I'm part of the UBC chapter. I'm a student in Vancouver. So very happy to be representing CSSDP here today. Before we introduce, or before we get into any kind of housekeeping or get into the presentations, I think it's important that we acknowledge that we have people joining this not webinar, this gathering from across the country. And so as I mentioned, I'm joining from Vancouver. Vancouver is situated on the unceded traditional territory of the Coast Salish people, including the Musqueam, Squamish, and Tsleil-Waututh nations. And so I ask that you just take a moment to think about whose traditional territory you're joining us from today, and reflect on how colonization of these lands and the first peoples to occupy them continues to magnify the stark health inequities that we see between Indigenous peoples in Canada and settler Canadians generations later. So, and I'm sure everybody here is very well aware, these disproportionate harms remain very evident in the selective enforcement of our drug laws and the overrepresentation of Indigenous people in Canada, in Canada's criminal justice system. So if, like me, you're a settler in Canada, you might not be you might be unsure about how to move forward respectfully and in the spirit of reconciliation. So a good starting point is to become familiar with the Truth and Reconciliation calls to action. And so maybe we'll have Sophie just kind of go into the logistics of the French translation, if that's okay.
Yes, can you hear me? Okay, great. So I'll just start with a few words in French and then I'll repeat in English. Alors, bonjour tout le monde. Moi, je m'appelle Sophie. Je vais offrir l'interprétation simultanée aujourd'hui. Alors, si ce n'est pas déjà fait, vous pouvez activer les sous-titres. En bas de votre écran, vous allez voir CC ou sous-titres. Alors, si vous cliquez là-dessus, vous pouvez soit activer ou désactiver les sous-titres. L'interprétation est offerte à l'écrit. Et vous pouvez aussi choisir la police, ajuster la taille de la police des sous-titres et afficher les sous-titres dans une boîte ou dans une fenêtre à droite aussi, en transcription intégrale. Si jamais vous voulez intervenir en français, vous pouvez le faire et je vais traduire à l'anglais pour le groupe. So I was just mentioning how to access the interpretation, which is available through closed captioning. If you click on CC at the bottom of the screen, you can activate or remove the captions and adjust the size or have them show up in a window on the side of the screen as a full transcript. And thank you for not speaking too fast so I can make sure that I keep track with what's being said. Thank you. Merci.
Okay, so first I want to thank everybody for joining us today. We're real excited to bring this webinar to you, or like as Stephanie said, not webinar now, it's a Zoom meeting. But so Stimulus 2020, the conference, I don't know if you're all familiar with it or not, but as somebody who's attended Stimulus in past, it was one of the best conferences that I've ever attended as a person who currently or formerly uses drugs, and the community of people that we've met there and kept relationships with over the years. And so this year, CAPUD and CDPC and AIDQ decided to partner together to do Stimulus 2020. And as everybody knows, COVID sort of derailed that plan. And so we've had to now postpone stimulus, the conference 2020. But in the meantime, because we have such an amazing SNP committee, or like the implementation and planning committee, and our executive committee, we decided collectively that we would carry on with some webinars, understanding that of course we can't create the same type of community that happens at Stimulus at a face-to-face conference. But this was the next best thing, to still have a community of harm reduction, drug policy, people plugging away, while recognizing all of the harms that are still happening and disproportionately impacting people who use drugs now, with multiple crises with the overdose crisis, housing crisis, and now this COVID. It's very sobering, no pun intended, that we're having these engagements to discuss all of the problems that people who use drugs are facing. So again, I'd like to welcome you all for joining us, and hope that you enjoy the speakers we have. They're absolutely amazing. I'll go over a little bit of housekeeping. So as you already noticed, the recording, we're recording the session. There's the ability to have the recording paused. You'll need to let Stephanie or I know, or Shay in the chat box. And then we will turn it back on after you've spoken or whatnot, if you don't want to be recorded. All of us are trying to create, or will create actually, a safe space, including respectful communications, honoring people's lives and the journeys and information learned. After each speaker, we're going to allow 2 questions. To be inclusive, we're hoping to have 1 question from people with lived and living experience, and 1 question that doesn't identify as a person who uses or used substances. And so how you would do that is by saying PWLE before your question in the chat box, to let us know so that we have the acronym so that we can be inclusive and make sure that everybody has the same stopping. Private message Shay if you want to ask confidential questions where you don't want your name notified. That you've seen Shay with her happy book there at the beginning. There will be time at the end for more questions, and so after and immediately after each presentation. Just remember that there are some background documents posted on Stimulus website. Shay will also post that into the chat. And we want to ensure people who are currently accessing drug sellers in real time or through the darknet are heard from, and so we want to make their questions first where possible. Alrighty, so I guess it's me. I'm going to go with my drug survey. So Matt Vaughn, my program coordinator, and myself, we recently did a drug survey with members all throughout Canada, and to find out what was happening on the ground. So I'm just opening this file. So I have a short slideshow that I'll show you of the results that we have. So let me share screen first. That would help. Okay, so basically we did this to track drug market trends that were happening throughout the country and how people who use drugs were experiencing these harms or non-harms, if that was. First, would like to acknowledge that the lands that we live and work on are lands of the First Peoples of Canada. However, while acknowledging territory is very welcome, it is only a small part of the cultivating of strong relationships with First Peoples of Canada. Acknowledging territory and First Peoples should take place within the larger context of genuine and ongoing work to forge real understanding and to challenge the ongoing colonialism. We strive to collaborate and respect all of the tribes of the First Peoples of Canada. So as I said, we spoke with members all throughout Canada, specifically 18 members, and we tried to ensure that we had representation of urban and rural in each area. While recognizing we didn't get everybody in every province, you know, we were under a time crunch to try and get some results prior to this form. So as you can see, 15.8% were rural respondents and 84.2% were urban. And basically the methods that we used, we conducted informal discussions with drug users all over the country about the current state of the drug supply during COVID-19 era. We sent out a Google survey document and followed up with willing participants for a casual conversation about the illicit drug market. Participating members lived in various areas, Vancouver, Edmonton, Toronto, and St. John and Halifax, to name a few. And as you can see, people identified, we didn't ask for gender, we just asked people to identify how they identify. And the largest age group of respondents was the 24 to 44 age group, which was 77.8% of the respondents. So yeah, that was the main amount of people that we had. There was 18, I said, so it varied. Participant and ethnicity, everybody identified their own ethnicity. And as you can see, there was percentages there on the below, and we tried to ensure that we have Indigenous representation in the surveys as well, represented. So preferred drugs, so it varied, but these were the ones that came out most, like cocaine, fentanyl, crystal meth, ketamine, heroin. And so these were main theme drugs throughout all of the people throughout Canada. Interestingly enough, not one person said that they only acquire street drugs, drugs through prescription only. But 63.2% said that they, you know, get both street and prescription. Changes in the drug supply. So the two main changes in the drug supply due to COVID-19 from our participant perspectives were availability and price. And as you can see, it was a large concern among all of them. Other changes included potency, criminalization, fear, and accessibility to the drug market. And we did break up the individual's concerns, and as you can see, it's common through all of the participants. Most of them have the same concerns in the changes that have happened. And lastly, we have some quotes here, and I think that these are really important for people to understand the difficulties that people face, especially during COVID. And it's been more difficult to find drugs during this pandemic, one says. And as I don't have access to testing tools, I am more at risk because I've consumed drugs from a new, potentially dangerous source. So, you know, as we move through today, I hope that we can all recognize that COVID is affecting people who use drugs disproportionately in ways that are similar to what we've experienced previously, but probably on a much larger scale. So I am done with my presentation. Thank you for listening. And we will move into questions. Does anybody have any questions?
So it might be easier to ask a question in the chat function just after these presentations to keep it brief. And then at the end of all the presentations, we'll have more time for kind of a more dynamic question and answer period as well.
And we'll be posting this anyway on CDPC's website, both the survey and our findings. So we'll have like a one-page fact sheet on it as well.
A question is, can you share the format of the survey? So the actual questionnaire that you use to elicit these responses.
Sure, we could do that. Can they send their email in the chat so that I could send them the Google form?
Sure. So if the person who asked this question, Mohammed, you could private message Natasha with your email.
It'll be on the one pager that Matt's. Thanks, Matt. Question.
Okay, so we have time for two. So one question, is there any indication of increased toxicity of drugs?
So potency was one of the concerns that the participants had discussed. But it wasn't so much that it was stronger, it was that the participants felt that the substances were actually weaker, if my mind serves me correct. So, and prices have gone up as well. So I see somebody in here saying in the chat about accessibility and pricing. So from the respondents' survey results, we found that a lot of people were finding that the price was skyrocketing and that the substances that they were using weren't as strong as they were prior. And somebody else about the number of participants. There was 18 participants that we surveyed all across Canada. 2 from the provinces that were shown in the beginning, 1 urban and rural from each area.
Okay, so if you have any other questions about this presentation, we can come back to it at the end of all of the presentations. So we're going to move on just so that we make sure all of our speakers have time. So our next speaker is Mike Gilbert. Mike, or Michael, I'm not sure what you prefer to go by, so I'm sorry, is an Oregon-based public health technologist with specializations in epidemiology, health informatics, policy evaluation, and harm reduction. His past work includes design and implementation of public health informatics tools, research on successes and challenges in community-based distribution of naloxone, and development of technologies to support the health and well-being of people who use drugs. His current work focuses on the design of tools to understand knowledge, attitudes, practices, and experiences related to drug use and direct service with local harm reduction programs. So welcome, Mike.
Thanks, Stephanie. Hi, everybody. So I'm here to present about sort of changes in darknet markets and forums in the context of COVID. And so I think before I jump into darknet markets per se, we should sort of start at the beginning with sort of the origins in forums and the sort of predicate that since there's been an internet, people have been using it to seek and share information about drugs, to coordinate transactions, and to find community. This happened on any number of forums you may be familiar with over time, some that were specific to drugs, like, say, Blue Light, or experience vaults like the Arrowhead or like Hayam. But towards the sort of end of the first decade of the century, 2010-ish or so, we started to see sort of a shift in both the sort of technology and social dynamics of online communities that led to a shift towards what we now think of as darknet markets, or and darknet forums as well. And so, the main predicate of this was censorship. Some of this was done by sort of law enforcement authorities who are trying to censor discussion of drugs and threatening web hosts and other people who provided infrastructure on which these sites operated. Some of what was done is sort of a necessary element of self-protection by people who are running forums. So, for instance, if you're on, say, Blue Light, generally not very welcome to discuss the transaction layer of drugs. Talking about the price of a product in a place sort of starts to tread into the line of, dog whistling offers, which, though not condemned by the people who operate the site, is seen as something that could potentially put it at risk for its sort of core sort of raison d'etre of harm reduction and peer support and community building. So in the context of sort of censorship, both sort of internal and external and moderation discretion, there also emerged things like new, easier to access privacy tools. The Tor browser became considerably more stable and easy to use. Things like Tails and other operating systems whose sort of histories wipe at the end of every session, and say PGP, which allows you to communicate with sort of end-to-end encryption that you can control and verify with other people on the internet, allowed people to communicate in ways where both their network identity, their human identity, and the content of their conversations were protected. Of course, another element of this was cryptocurrency. So the emergence of Bitcoin and the other cryptocurrencies that follow allowed people to not only share information, but also exchange something of value in a sort of objectively sort of what's referred to trustless but verifiable system where you can send somebody something over the internet without necessarily tying your name to it. And they can be confident in its value and make sure that you're not sending fake notes or what have you. And then the fourth sort of thing, so we have censorship, the emergence of privacy tools, the emergence of crypto, and then the sort of familiarity and comfort with e-commerce was just like becoming a common part of many people's daily lives at the time, and that's more of a social convention that just made people confident in the concept of sending people money on the internet in exchange for goods, and that sort of familiarity and comfort sort of created the scenario in which crypto markets could come to be. And so at first we had things like the shift out of forums and into markets was largely based on a couple of specific advantages. One, they have escrow services so that, when you order something, you can sort of put the money into the hands of the market. When you receive your product, you can release the money to the vendor. This gives sort of security on both ends. And it also creates an open marketplace where it doesn't matter where you live or who you know, everybody can communicate with anybody. The volumes that are transacted aren't controlled. You can do everything from a single tab of acid to a kilo of cocaine, and all in the sort of same seamless interface using that same stack of tools that I mentioned before. So, with the emergence of, say, the Silk Road and when that got shut down, evolution and on and on and on, the sort of motives for using the markets have, remained sort of fairly consistent. The first, as I alluded to, is access. That's both access to drugs that might not be available in your particular community. If you want some black tar heroin and that's not available on the east coast of Canada, then there is a means to access that. Or if there are specific products that meet your needs, like with respect to whether they will pop positive on a drug test or whatever other sort of performance characteristics you're looking for, one can access those things through darknet markets in ways that would otherwise, in sort of a face-to-face social network, require knowing somebody who knows somebody who knows somebody, with a little more volatility in the supply chain. Another thing that was sort of mentioned in the survey was quality. There have been a couple studies of the quality of products that flow through darknet markets. Some suggest that, especially in some sort of product classes or categories, the quality is quite good, quite high, and also the quality is sort of vetted and discussed by peers. So in the context of a market, you have a vendor with a product and there are reviews for that product and that vendor's offering of that product. That's not something, that's not a volume of conversation that we can often access in sort of face-to-face interpersonal, and social networks, where you can have hundreds of reviews, thousands of reviews of a particular vendor and their product with a sort of open and candid discussion, although there are some sort of conventions and preferences where, if you buy something from somebody and you don't leave a positive review, they may not choose to sell to you again. So, I always say take the sort of review elements of quality with a grain of salt. But nonetheless, quality of the products is, generally, fairly high and the subject of discussion within the community. Safety is another element where, often the transaction layer of acquiring or selling drugs is where some physical risk comes in for some people. The advantage of doing it from the, safety of your keyboard or tablet or wherever it is, however you access the darknet markets, is that you're not in physical you're not putting yourself in a potentially physically precarious situation. The counterpoint to that is you are sharing a mailing address, and so one has to be careful about the operational security. You know, if you're down on the corner, you generally don't tell people, you know, exactly where you live, or you know, if they didn't know. And so there's a different element, and you know, often that sort of interpersonal, you know, sense of, or that sense of safety or insulation using technology is counterbalanced by the fact that people then, you know, are in their homes or at whatever address they've given, you know, looking nervously out the window while a package is in transit. And so you sort of trade safety for anxiety in a lot of cases. Of course, liberty, you know, nobody wants to get locked up or fined or otherwise punished for, you know, for using drugs or having any sort of other sort of role in the market. And crypto markets offer some, you know, substantive protection against that if the proper precautions are taken. And then lastly, before we dive into the sort of market elements themselves, the sense of finding community is a big motive for using these markets. So there are a couple of academics who have written very nicely about the content of the forums on these markets, where people can find other people who are interested or experienced with the drugs that they're using or interested in using. And then those conversations often, you know, expand into politics and spirituality and other elements of, you know, say social justice and, you know, topics that people find common cause around that aren't necessarily drug related, but they're sort of adjacent and ambient in the community. And so finding a place where you can talk in an uncensored context about your life and experience and aspirations, you know, whether or not those are being discussed in the context of drugs and drug use, is something that's increasingly rare on the web, and has sort of found a home in certain corners of darknet market forums. All right, so let's get a little bit into the sort of volatility aspect of this, or the sort of the current context. So as I mentioned earlier, the markets have come and gone over time. Some of that has been through interdiction. Some of that has been through what's referred to as exit scams, when somebody sees an opportunity where they've stacked up a bunch of cryptocurrency and they're able to just exit the market and keep it all without, you know, distributing the product. These have both happened over and over. This happens at the market level. This happens at the vendor level. This has happened, you know, even recently, you know, or in the last several years. There's some prominent examples from vendors who ship from Canada, like say Après was a prolific manufacturer and vendor of counterfeit alprazolam products, or, you know, Xanax bars, who, you know, posted videos of their, you know, pill pressing operation, did an Ask Me Anything on Reddit, was sort of very open about their sort of structure and practice and volume, and you can look into the court cases if you're interested in that. And there's a lot of drama, you know, surrounding it, and the sort of received history of that is that that sort of radically shifted the market for Xanax bars and alprazolam products, both in Canada and in the United States, and sort of created changed the pricing at the street level for a lot of people, and just sort of primed the pump on web-based distribution of these products, because a lot of times people would order in bulk and then resell, and maybe they weren't reselling through the markets themselves. They were doing it through, you know, personal networks, or they were doing it through Instagram and Wicker, or some messaging apps that you know, allowed them to move smaller products a little more agilely, and they didn't have, you know, people didn't have to go through sort of all of the steps of, you know, learning new technologies and having separate devices and everything that, you know, sometimes darknet market access entails. Another more recent example would be a prominent vendor of fentanyl containing products, CDN Ben, has sort of recently sort of gone quiet on the markets and forums. You know, previously they were sort of a notorious, famous, perhaps infamous character, depending on who you ask, who was selling different levels of fentanyl-containing powders that were, you know, had different potency, and where, you know, one had to have sort of prior orders in order to get access to more potent products. And so they're sort of introductory level products, and then one could through, you know, repeated sort of business and demonstrated experience, access different product grades over time. There's a lot of other sort of elements of volatility in the market. So I've mentioned a little bit about how the markets can often come and go, and vendors can come and go, and often people who are ordering drugs on the dark net will sort of have this initial sort of rush of curiosity and engagement, and often stock up. There's some great papers from Monica Barrett on the sort of patterns of engagement with darknet markets. And I think one of the things that we're seeing now, as there's still volatility in the markets, the largest of the markets now, I believe, is Empire. It's under constant denial of service attacks. There are others, and that's just sort of the norm. And in this context of markets always come in, markets always drop out. Vendors show up, vendors, exit. We now have a lot of people coming to the markets for the first time. I am a moderator on a couple of forums where there are, a dozen requests a day for people to sort of show them the sort of general ropes of how do I use these, or who do I trust, and how do I navigate this environment. There's a lot of uncertainty, and there's a lot of work to help people address that uncertainty. And so what I've seen a lot in the last couple of months is that many people are sort of coming to, say, a forum, and they're interested in a given product or vendor, and there are swarms of people who will all then respond to them, offering them links to phishing sites, offering them the wicker address of somebody who will gladly take their money in exchange for no product. And so it's sort of like, it's a bit of a Shark Tank in some of the forums right now, where you have folks who are coming in search of, information, and they're seeking information, they want to share information, they want to discuss their experiences, and there are plenty of people willing to rip them off, essentially. And so helping folks to sort of navigate through the sort of trust economy, some folks will move through that. Some people will, are inclined to or able to set up the technical resources and workflows to access the market safely. Others will just say, whatever, there's a guy on Insta reselling this stuff, that's the path that I'm going to go with. I'm not here to gatekeep. I'm not here to tell anybody what to do. I always encourage, maximal sort of security practices where practicable. But there are sort of facets of this market that reach outside of what people think of as darknet markets and into forums and social media platforms, and that sort of provide points of access with differential risk. And so we find ourselves in this moment where maybe the price of people's products are going up, maybe the quality is going down. As people think about darknet markets as alternatives to sort of the conventional supply chains or networks through which they sort of buy or sell drugs, I think it's really important to find trusted peers and to sort of share experiences with people who because often this element of internet use is quite anonymous, but we have a lot of resources, say within the harm reduction community, folks who are familiar with the technology, folks who can provide some sort of guidance, at least if not direct sort of screen share how-to, at least documents and such. I'm always happy to point folks in the right direction. And I think also it's important to mention that there are some really important there are some opportunities to translate some of the technologies and practices from crypto markets or from darknet markets into sort of harm reduction services and just peer support networks. Learning PGP is a great skill to have. It's something that ensures that you can send messages privately. And looking at how the markets work and how they manage privacy sets a good model for things like web and mail-based distribution of harm reduction resources, be those, safe injection equipment or naloxone or whatever else people want to move in the context of safer use, safe supply, or what have you. I think I'll pause there. I'm not sure where I am in time, but I'm happy to sort of take some questions and use the remaining time to address this.
Okay, so we have a question from the chat. Jordana asks, what suggestions might you offer to individuals who are new to darknet markets with regard to safety?
Yeah, so I'm going to interpret safety here a little bit as like operational security. There are a couple of documents that are quite good. There's a document called the DNM Bible, DNM Darknet Market Bible. You can find that, I believe it's prominently linked on Dread, which is one of the forums. Dread is a Reddit clone that operates as a hidden service. You can find a link to that at dark.fail on like the regular ClearNet. And then, download a Tor browser, learn how to use it. The number one thing that I would say is if you are going to be engaging in transactions or in even discussions that could, potentially put, you at risk, make a hard line between your ClearNet sort of identity and behaviors and your sort of darknet activity. So to the extent that you can, like, never use the same usernames. Don't, because, well, A, it's not trustworthy. I mean, I can use anybody's username and impersonate them in another format. But two, you want to make sure that you have, new usernames, new passwords, and sort of a firewall between, think of it as two online identities. If there's a hardware separation you can do, that's also very good. One of the recommendations you'll see in there is to use Tails, which is an amnesic operating system that runs on a thumb drive. You can plug it into a computer, run, use it as you will, and when that thumb drive comes out, it forgets everything that just happened. Like, there's no cache, there's no retained buffers, and none of the activity is then preserved on the device that you're running it on, your normal laptop or what have you. So I'd start with getting familiar with something like Tor, like on whatever platform you generally use. Reach out to folks who myself included, and then as you approach something more legally risky, start to implement the sort of, guides and lessons that we can find online.
Great. So we have lots of questions. I'm going to ask the next one that came in order. And then the other ones, we're keeping track of them, and we will hopefully have time to come back to them at the end of the session. So the next question comes from Darvel Long. So they say, coming from the NetSec or VPN industry, and they have a lot of, and with a lot of knowledge and experience with the history of darknet markets, I wanted to ask if you see that we can synthesize legal versions of a good amount of drugs through analogs that get past the law and are sold on the ClearNet. Do you see that as potentially impacting the darknet drug market?
Yeah, I mean, I think one thing to recognize is that, many of the products that are being sold in the darknet now were sold through research chemical ClearNet markets before. So yes, there are, relatively straightforward routes to synthesis for available precursors. Those are being, increasingly monitored and regulated, I'd say, too. And I think it's a strategy that can work, but it's a time-limited strategy where, say, in the States, we now have a sort of blanket regulation that covers anything with sort of the functional backbone of fentanyl. So there's no more of this sort of one-off whack-a-mole of regulation of new analogs. And we're starting to see the same thing with the isotonitazine and the other idazine analogs, where rather than sort of following these one by one, the sort of MO of the powers that be in the drug war, it has been to start with the precursors and then, would monitor and control the precursors, and then to increasingly look towards more broad bans or more broad regulatory interventions and interdictions on the resulting products. So yeah, you can find the analogs. The other thing I would mention is it seems sometimes like buying an analog can be the safer thing to do because maybe it's not a controlled substance, and so hey, it's legal, I can buy it. It is also something that is very closely watched. So I think there are elements of risk that come into play where you can be doing something nominally, or completely and, nominally and practically and functionally legal, but it will still attract the attention of people whose sort of surveillance might not be welcome. And so I don't think lowering the guard and saying like, oh, I bought it on the ClearNet so I don't have to practice operational, the same degree of operational security is necessarily a good strategy. Not that I'm suggesting that was suggested, but just to put it out there, just because it's on the ClearNet doesn't mean it's risk-free. And there's still, I think, good lessons to be learned in how to protect yourself, from, the sort of norms on darknet markets and forums.
Thanks, Michael. I think we accidentally skipped over the person with lived experience question.
Oh.
So I hope everybody doesn't mind that I'm going to address one of those questions right now. So this came from Matt Bond, and he's asking, what was the biggest impact on Canada from the darknet, positive/negative, and what is the best PGP messaging chat for drug user groups to discuss these things?
Yeah, well, that's a really good question. So in terms of the biggest impact, so could you restate the first part of the question? I just want to make sure I address it specifically.
Okay, what has the biggest impact been on Canada from the darknet?
Oh, sure. So I think it's the sort of flattening of access to products, especially to fentanyl products early on. So back in 2013, 2014, it was trivially easy to bring fentanyl products into Canada. It was a little easier to find people who would ship to Canada than into the United States. So there's a little bit of a preference for shipping fentanyl products into Canada versus the US. And so perhaps that created a sort of a market advantage, and that I think that still has sort of recurring echoing impacts in the market at all levels for opiates in Canada. I think other things like I mentioned, like the sort of boom in benzodiazepine production, at least here in the States, it's sort of perceived as largely coming through Canadian vendors. The most prominent of the vendors had generally been operating or shipping from Canada, and had been then once they got into the States, resold. People were very explicit. I am reselling this person's bars and what have you, but there weren't those sort of manufacturer distributors, as many of them, directly in the States. So, I think just like the fact that there was sort of easier shipping in and out of Canada, especially over the last 10 years or so, really made a big difference in people's ability to sort of take a little entrepreneurial initiative, order products and distribute them in ways that it's much harder to do if you live in some other countries. As to what the effects of that are on the ground in Canada, I can't say. I'm in Portland, Oregon, so I'll leave that to the folks who lived the experience of the market there. In terms of the best PGP thing, so I generally don't use chat, like real-time chat for a lot of functions. I just like to keep it as simple as possible. I like to verify people's keep people's keys and use, say, like encrypted email where I'm sending encrypted messages within them. When it comes to something like group chat, Signal is the sort of default go-to. I would say though that the software platform is always going to change. Like there are going to be new vulnerabilities and new, stronger alternatives always over time. So I'm always very hesitant to recommend software specifically. And regardless of the software, I think the much more important factor is the practice amongst people who are involved in that chat. If you leave your devices unlocked, if you copy content out of an encrypted format, you know, basically setting some expectations and guidelines and check-ins around how people treat sensitive information in clear text is the most important part of the chat. Let the technology shift over time, and I think you know, you can look to the Electronic Frontier Foundation and other organizations for guidance on, you know, vulnerabilities, and if you know folks who work in the NetSec space, you know, they'll be able to provide very good tabs on what's, you know, the latest and greatest. But the best technology stack paired with a risky practice in the use of the technology obviates any protection that the tech might provide.
And so, Michael, just before we move on to the next guest, you just mind explaining to some of the guests what PGP means?
Oh yeah, I believe it stands for pretty good privacy. It's an encryption It's an encryption standard, I should say. So for like if you're on a Mac, you would use like GPG tools, generally one of the standard packages. And basically what it allows is that you can create a public key and a private key. Well, without getting too deep into the sort of workflows of it, it's a means by which you can send somebody a secret message. It's just a big block of random characters. And that person has to have the private key that matches with the public key that you encrypted it with, and their password in order to read it. So it's essentially like it's an old protocol, but it's a very strong one when used correctly, and it's a good way to share information in a secure way so that only the intended reader can access it if the intended reader keeps their keys safe and keeps their password secret.
That's great. Thank you so much, Mike. I think that was really helpful and insightful for a lot of people here, just based on how many questions that came out of this discussion. So hopefully we'll have time to revisit some of them after. But in the interest of time, we're going to keep moving on because we have a few more speakers that we're really excited to hear from. So next will be Julie Soleil-Nissen. Julie Soleil obtained a bachelor's degree in social sciences, addiction, criminology, and mental health from the University of Montreal in 2000, followed by a master's degree in criminology in 2005. Currently, she is the content and practice development manager at the Association des intervenants en dépendance de Québec, or ADQ. For the past 4 years, she has been part of the Anchors team, which analyzes substances at the Shambhala Festival here in British Columbia. Her current projects are concerned with drug checking, new drug trends, drug policy, and nightlife harm reduction. So welcome, Julie Soleil.
Hello, everybody. Thank you for the nice introduction. I'm really honored to be here and having this opportunity to talk to you about drug checking, which a lot of people know how passionate I am about this subject. Of course, I've been involved in pushing this practice in Canada for many years, and I hope I will be able to transmit some of my knowledge to you today. I want to recognize that drug checking is one of the tools we have to get more information on substances that are on the illegal market. I know it's not a panacea and that we need a regulated drug market before we can buy drugs freely, meaning any substance at any time, and this just for fun. Drug checking will be an important part of the knowledge gathering that we need to stay safe as substance users. Drug checking for me, as a lot of my colleagues know, has always been about having a conversation with people who use them. Drug checking is about finding more information on substances people like to use, and then being able to give them more information so that they can reduce many risks concerning drug use, especially with an illegal market that is really contaminated, and this across Canada. In Canada, we lack control of substances, and this makes it very complicated for people who use substances to know what's in their drugs. In this context, Without drug checking, people who use drugs will look at the texture, the color, the smell, will taste, and will try it. The effect will often tell us if the substance is what we expected it to be. But today, more often than not, this puts our community and people we love at risk because a lot of the time, or most of the time, the substance is not what we're looking for. I need to say that this at the beginning, the statistics are the things, or the drugs that I will be talking about. I will be taking this from different drug checking services that are available in Canada. One thing though that you guys have to know, drug checking is not available everywhere. It's mostly available, possible in 2 provinces, BC, which also has more places than one in British Columbia, not only in the city of Vancouver, but there is also in Victoria and other places, and Ontario, which are the cities of Toronto and Ottawa, which are the 2 places that have the most drug checking. There are other possibilities, other drug checking projects that are on and off and that are not as engaged in Quebec, Alberta, or Manitoba that are trying to push forward, and there's probably other provinces that are trying to do it also. We do also have many provinces or places or harm reduction places that use benzo and fentanyl test strips, so we have those types of information. Also, what I'll be talking about of the different substances that I've selected for this talk today. I also looked at all the drug analysis service data, which is from the DAS data, that does a monthly report on results on the tested, suspected illegal drugs seized by the Canadian law enforcement agencies. They do not have the same objectives as drug checking services do. They are trying to detect if there is an illegal substance in the substance that they're testing. The data that we have at the moment from the DAS, we used to have about 6,000-7,000 different samples that were tested. The last time we were at not even 2,000 for the month of April and things like that. So it's gone a lot down. So a lot of the data that I will have will be close to the COVID, but inside a little bit because there were some of them and things like that. But most of the data is between January, February, and March. So close enough. And we're seeing, and then the drug statistics are from the drug checking. Will corroborate that data. Of course, drug checking since the COVID pandemic, the number of samples submitted are going down, like I said, or there's not enough people being able to test them because of the social distancing and things like that. There's changes in confinement, isolation, physical distancing, and many other elements also are making it really hard to get information out in many parts of Canada. For example, British Columbia has the most drug checking in Canada, with many sites across the different public health regions. They have community-based and also festival drug checking. Today, I will only talk about the community-based stuff. The festival drug checking, as a lot of people know, well, there won't be any festivals this summer, sorry. And we wanted to talk more about the community-based substances that are being used. Like that. So, during COVID, some of these sites are closed or have cut their hours because of, like I said, social distancing, confinement, and things like that. But others have adapted, are staying open, have found other ways to get samples and things like that. But of course, we're seeing a drop in the samples, say in Toronto also, where I took some of my information. The samples that are submitted go down, but there is ways to drop off. Drug checkers go on site also, are going places. People are going on mobiles, bringing their stuff to where people are using the substances and trying to find that. And there's always the possibility to post the substance, little samples, and send them off. Of course, the time that the sample takes to be tested is also an issue. Sometimes before it was very easy, accessible right away at the safe consumption sites, say, and now, well, with the drop-off, it takes more time, and so the risk is that people will use the substance before testing it and things like that, where before maybe they were testing it before the use of it. So we were able to talk about some harm reduction measures and things like that. So for me, drug checking is essential because it gives us more information by learning about drugs, learning about adulterants, learning about precursors, and the drug market itself across cities, regions, provinces, and the country. For example, we can send some alerts. We can monitor. We have more monitoring tools, looking at what's there and how we can pass that information between us, between people who use substances, and also between people who work with people who use substances. So this information needs to circulate and able to have it in a time that is not too far away from that, because as we know, drug markets do change and are not always the same during all this period. More ways also, what drug checking also does is more ways to minimize risk concerning novel substances. As Mike was saying, there's a lot of those. There's a lot of new substances. There's a lot of novel ones, substances we don't know a lot about. There's toxic substances. There's very complex mixes also. I'll be telling you a couple, which I practiced how to pronounce most of the words because it's quite complicated today. There's a whole bunch of mixes of not just 2 substances, but sometimes 3, 4, 5, or 6 different substances in the same, and which have all different ways and effects that affect the body and things like that. So we need to figure out what messaging and how we talk about the substances. For example, there's been for a while benzos mixed with fentanyl. We've been hearing this across Canada a little bit. There's the Toronto Drug Checking Service that gives out a bulletin every 2 weeks with different samples and things. And one of the messages, key messages, which I found very interesting to tell people about this, is that the negative effects of using an opioid in combination with a benzodiazepine includes respiratory depression and extreme sedation. If naloxone is administered, it will address the effects of the opiates, reverse respiratory depression, but it will not reverse the sedative effects of the benzodiazepine. So as people who use drugs and as people who work with people who use drugs, knowing this and having this knowledge is very important, because this can save lives for the people with whom we're using drugs, or people that we are in contact that are using these substances. Because it is false to think that everybody that uses substances knows everything about the substances that they're using. I've been doing nightlife harm reduction and education on drugs for many, many years, at least 20. And I know a lot, and there's a lot of new users and unexperienced users, people that are wanting to try a new substance and things like that. So it's very helpful to be able to get knowledge, to bring that knowledge out, and for people to use it to minimize the risks and hopefully not die using these substances. As I just said, the data that I will present is very limited and is often done by very different technologies also. So the different drug checking communities are not using all the same types of technologies. Some are more sophisticated than others. Some are more performance than others. Some know how to use them better, or blah, blah, blah. There's all those different things. But we're able to do a little picture of what's going on the market at the moment. So I will extract 2. I decided to go with stimulants and opiates, two substances that are quite prevalent in Canada, across Canada, and I will be talking more on the Canadian perspective. I'm not going to go province by province, because this morning I did a nice, beautiful thing, but that would take way too long. I don't have that much time to do it, but I'm sure we will put up all the references, all the stuff that I'm referring to. We will be putting that up on our website, on the CDPC website, the COVID and harm reduction thing, and on the, so we can, or wherever we're going to put it, we will have a lot of the different references for you. So the stimulants, as we look at the DAS or we look at the drug checking, is is a very prevalent use in Canada. Mostly we see methamphetamines or cocaine. And when we test those substances, as you know, methamphetamine can be crystal meth, can be ice, can be speed, can be all kinds of different things. It's methamphetamines, and cocaine can be crack also and things like that. So when we're testing them, we will ask the person, what do you think this substance is? And then we'll get through and try to figure out if that substance is what that person thought it was. So one thing that comes out, because I have this discussion with my friends out west, I live here in Quebec, and I always talk about cocaine and methamphetamines being very different out west and here and things like that. And when I'm seeing the data and things, most meth is mostly meth out in West Canada. So from Manitoba to BC, it's pretty much methamphetamines. It doesn't have a lot of cuts, doesn't have a lot of stuff. Maybe some caffeine a little bit once in a while, but not as much as, say, Quebec and Ontario, where you'll see a lot of the meth and the cocaine is mixed with caffeine. So we have this other effect that's a little bit different when we use the substance. Also in the data with methamphetamines, and something that a lot of my colleagues have been telling me or talking to me about also, and they've been seeing, is meth and fentanyl, or fentanyl with meth in it, or meth with fentanyl in it, or using methamphetamines and then using fentanyl and things like that. So there is this mixture. There's a lot of the tests out of the DAS and the things that we see those two substances together. One limitation about the DAS and things, we don't see the percentages. We don't know really what the substance was supposed to be. You know, they don't do the drug checking the same way that we do. They're really trying for, you know, when they're arresting somebody and they see some substance and they want to use it in a criminal court. So it's quite different, but we're seeing those kind of things coming out. Cocaine is quite, there's a lot of different substances that are mixed with it, and across Canada there's different things. One substance that we're seeing across Canada, and it's phenacetin. Phenacetin is a pain relieving and fever reducing drug. It was used in the 70s. It was taken off the market because it had adverse effects on cancer and things like that. So it was quite taken out of the market, but we see that. We also see benzocaine and lidocaine. Benzocaine and lidocaine, and we know this when we test substances, sometimes people go, this is not cocaine, and then we're like, oh, but it is cocaine. But the people are looking for the lidocaine or the benzocaine in the cocaine because it gives them the numbness, right? It's an anesthetic, local anesthetic. So for the gums and the nose and things like that, people like that effect of the substance. And so they think sometimes when they, if they go from one province to another or another place, they don't find the same effect, and they don't like that. And so there is also levamisole, a lot less, and then maybe a lot of my other friends that are on the call, they could say this, but levamisole has been there for a long time. It's been part of the cocaine and things like that. It's a dewormer. It was linked to all kinds of stuff also and taken out of the market and things like that. But we're seeing less of the levamisole and much more of the phenacetin. And phenacetin is found in a lot of other substances too, as a buffer, as a substance to an adulterant to cut the substance. One thing also that's very particular with the market, and that I was looking, is that there's a lot of mixes of substances, and the knowledge to know this is important as a drug user and it helps, like I just said before, to reduce harm, and also it also complicates it, because then when we don't have the drug check-in or we don't know what we're doing, then we have to find ways, and it might put us at risk. So sometimes we don't know what's in the substances. And I'm just going to give some little examples of substances that have been found. And it's not like, I'm not saying, I'm just saying these are things that are found in the drug checking and different substances put together. And sometimes, well, when you're a person who's trying to give information, and if you don't know all the different substances that are in there, what they do and how they react and how they counter react, and you know, all the factors also of the person, the tolerance, if the person's a new user, a woman, a man, or blah, blah, blah. And there's so many other factors that influence the effect of the substance. So one of them in BC, it was methamphetamines, itizolam, fentanyl, carfentanil, and caffeine. So we have 5 substances. We have fentanyls that are more the opiates, itizolam that is more in the benzos, methamphetamines that are more in the stimulants, and then we have also the caffeine that's in the stimulants. So when we have a substance that has 5 different substances, this reacts very differently in your body, and this can put you way more at risk. So knowing these different substances and knowing that they're there, drug checking can help us be able to give the best information in the world we live in, of course, in this illegal market. In Quebec, there was cocaine, meth, caffeine, and diphenhydramine, which is an antihistamine, sorry, for my French. So these are also very, you know, there are 3 different stimulants put together and all these counter reactions. And a lot of people do in Quebec talk about methamphetamines or caffeine in cocaine, and the cocaine, a lot of it does have caffeine in it, and the effect is completely not the same if you have the cocaine by itself. One last example also that I saw in Ontario and in Quebec, methamphetamine, caffeine, diphenhydramine, the antihistamic that I just talked about, and then methylbenzylamine. And this, when you look at the chart and you look at what it is, this may be harmful when it's inhaled. Materials are extremely destructive on tissues and mucus and things like that. So if you're doing methamphetamines and you're smoking it and things like that, it can up the risks on you. So knowing these different things can be helpful, and being able to bring out that information and let it go out. So I'll go to the opiates. Well, there's no surprise, the fentanyl, most prevalent opiate, from BC to Ontario. So Ontario to BC, it's the most prevalent, and there's Newfoundland also that has in their statistics quite high there. 59% of the opiates that are seized in Canada have fentanyl in them across Canada. Nova Scotia is the only province with the Northern Territories to have no fentanyl in the top 10 substances that are seized. So other provinces, the other provinces that I didn't name, were more on prescription pills. So Quebec, Newfoundland, Prince Edward Island, or New Brunswick. Sorry for, I have to learn all my provinces. So they're more with hydro and oxy, so more with prescribed substances and things like that, or less with fentanyl. But the fentanyl is something that we see, like with the mixes and stuff. There's a lot of different mixes that we're seeing. I have a whole bunch of different ones. One that there's synthetic cannabinoids that are leaning into the fentanyl in some of the places. BC had the Abfubinaca, and also Toronto. They found that in the drug checking and things like that. There's new synthetic opiates also. In Quebec, we had an alert on isotoniazine. Sorry for my bad expression on these words. And we're seeing also fentanyl with a lot, like I told you before, itizolam, flubromozolam, flualprazolam, so all these different benzos that are mixed with the fentanyl, and that's creating a lot of difficulties and things like that when you're using them or that. Other substances that I'll just, I named the benzos, they're quite prevalent also. We're seeing them across. A lot of it, people think it's alprazolam, the Xanax bars and things like that, but the drug checking and things are also finding itizolam, flubromozolam, and flualprazolam, and other benzodiazepines other than alprazolam as itself. And one thing I want to mention also, that is the only province that has this in the different things, places, and it also on the streets in Quebec, we've been hearing a lot, is GHB. I don't know if across Canada, I'm just putting it out there, but GHB in Quebec is quite prevalent, and it's linked to some deaths during the COVID and things. There's a lot of talk about it. So wondering if this is something that other people are seeing in more up and things like that. That would be awesome to know if other provinces or other places are seeing GHB. To finish up, many projects and many resources have not started their projects also. Many are not able to use test strips or give them away because resources are closed, or less resources, or outreachers are sick or on leave or not able to go to work because they have kids at home. I'm one of those people. So these are for example, right? So I'm gonna finish with a question, and I will also answer the questions that you will be putting forward, but I'll finish with this question. I wonder if it would be a good idea to put pressure on our provincial governments so that this practice can move forward and be more available across Canada, because the exemptions are there, the things are there, and we need to be pushing that forward a little bit more. And I wanted to hear you guys on that topic, because it's a possibility to do letters and stuff and activism on that side. So I will finish with that. Thank you.
Thank you, Julie Soleil. That was great. So we have time for 2 questions before we move on. So I'm just going to quickly monitor to make sure I'm not skipping anybody here. Okay, so the first question, je vais poser la question en français. So, Julie Soleil, pensez-vous qu'il y aura plus d'opportunités pour des sites de testage à travers le Canada? C'est un outil tellement important pour la réduction des méfaits.
I'll answer. I don't know what language to answer that in, but I'll answer.
I can translate the question too,
yeah,
if that's eeasier for everybody else.
But
so
I think Sophia is translating it. Yes.
Oh, perfect.
Or do you want to? Yeah. Well, after all this speech, I think yes, it's something. Of course, I believe in. I think we need more drug checking across Canada. There's not enough of it. We need our governments and people to understand that it's a good practice and it's able. And I know that the CRISM, and I know a lot of research, there's research being done and things that are bringing forward good prognostics on the practice. And we are the first country also that is using drug checking on a community base, which is very different than say Europeans use it very in the nightlife harm reduction, because I didn't talk about that aspect. There's very different populations and different things like that. So it's quite interesting that Canada is bringing this up, and a lot of the safe injection sites or the OPSs and places like that across Canada could be using this practice quite a lot more. The problem is a lot in the different rural communities and things like that, where all of these, well, where all harm reduction is less accessible. But I think pushing it, talking about it, as I've been doing for so many years, I think is the best way to push that practice.
Okay, so one more from Alex Betsos, who is a member of CSSCP. So Alex asks, is there any major changes in stimulant, adulterants, or buffs from COVID? Have you noticed?
Really, with all the limited data I had, it didn't seem like there was like, because the phenacetin, all the sugars, all the levamisole, or all the other adulterants are still the ones we're seeing. What I'm not sure about, because I don't do this every day, and maybe somebody else could, I find that there's a lot of substances that have 1, 2, 3, 4, 5 different substances in it, and that is, for me, scares me. I'll say it like that. I think the information and how we talk about that, and how as a drug user we can, you know, keep ourselves safe. How do we do that when there's this multiplication of all these substances in there? but I think the data is so not good enough. That's what I'm going to say, to be able to say that there's these new substances. And maybe people are on the call that, like Chloe or Jared or other people that are doing drug checking across Canada, maybe they can bring a little bit forward. But all the data that I looked very currently, I didn't see anything different in that sense, in the buffers and stuff like that. But I could be wrong.
All right. Thank you so much, Louis-Soleil. That was great. So we do have a few extra questions that we'll try. We're keeping track of them. We will try to save them. Hopefully, we'll be able to keep talking about this after all of the presentations are done. But we do want to move on and make sure that everybody has time to speak. So Natasha is going to introduce our next speaker.
Hi, so we have Erica Thompson with us today, and I don't have a formal bio to read, but I know Erica, and she's an amazing person. She is the new executive director of the BC Yukon Drug War Survivors, and she's going to bring the perspective of people who use drugs and or sell drugs in her province. Thanks, Erica.
No, unmute and start video. Start video. There we go. Hi. And I can't see anybody. Can you?
We can hear you though. Can you hear me? She's muted now.
Erica, in order for us to hear you, you have, there you go.
Got it. Got it. Hi. Thanks very much for inviting me onto the call. And due to COVID, it's too bad, like you said, that the community hasn't been able to get together like we do, because we so much need it. I'm probably gonna have to close this window for background noise. Hang on.
That's a good one.
There we go. So I'm going to introduce Phoenix as well, because Phoenix, and with the drug checking, Phoenix also does, I'll let her introduce herself, but she's also come on board for staff here at BC Yukon Association of Drug War Survivors. And so I'll let her introduce herself, and then I'll get into it.
Hi, so yeah, my name's Phoenix. I am part-time an executive member coordinator here with BC Yukon, and we're still trying to figure out what that looks like, but basically I'm trying to be a point of contact for our members and our groups and individual members across the province, really trying to promote their interests. So right now we're doing a feature on our board members. So yesterday we just put up a biography and a photo of one of our board members, Heather Spence, an Indigenous mother from, from Kelowna area. Yeah. So yeah, that's some of the exciting stuff that we're working on here. I also work for Vancouver Coastal Health as a drug checking technician. So I'm seeing a lot of the trends that Julie mentioned. So that's, yeah, that's me.
Thanks, Phoenix. Yeah, I just wanted to, as new staff comes in, and Phoenix has been doing this work for a long, long time, but she's been out there working diligently and hasn't been in a place where she can do active advocacy and come out. See me. Yeah, where people can see her. Yes. So she's come on board. So a little bit about what BC Yukon has been up to, and a little bit about what we're seeing, people who are living it. And so BC Yukon is a provincial advocacy group of people who are current users or former users, people who use drugs. And we don't fix people, we fix systems is pretty much how we put what we do. So that's a personal journey for someone, and we want to reduce the systemic violence and the harms and the barriers that consistently are what the realities of that we live. So when we remove those harms, we find that people then again, can start focusing on themselves and their relationship with substances. And we really believe that we've been born into prohibition, and that we want to take a look at how things would be if we regulated drugs, if we didn't live in a world that's been colonized and our substances prohibited, where we've been out of relationship, which means we don't have a lot of the knowledge that we should have, because it's criminalized, because of the stigma and discrimination, because we can't even barely meet in public spaces. These are the type of things that we are focused on right now. And so space has been priority for BC Yukon. We seed fund user groups, so new user groups. So as when she was saying, Heather is a board member, she also has a new group out in Kelowna called Can Do. And so what we're looking at is seed funding these groups across BC and linking them up together provincially so that we can carry the voice of the collective and the diversity of people who use substances across BC. And so that you're not having what, you know, and I don't mean to be offensive or for anyone to take this on, but where you don't get pet peers, where you have one person whose story is, you know, it becomes about them instead of we, and that really being able to learn how to carry that collective is so very important. And I really think it's the responsibility of people who use drugs when they're in this, when they identify as experts in this field, to really be aware of that, and to make sure that we do our best so that it's not our story all the time. Our stories are powerful. Our stories can move people, they can change minds, but that remember that it's all of our stories and just not one. So we've been coming together here, seed funding. We've been able to get space for Can Do. We have a new space in Chilliwack for another group in Chilliwack. And so looking at one in Surrey. And so these would be New Maple Ridge is I think they've got their space, but they haven't, we haven't put a lease on it yet, or they've got a lease on it yet. And so in order to help some of these smaller groups, we help them find that space, and then we provide a little bit of funding, and then we do some education, as I said, advocacy, education, and support. And so the education piece around that is around governance, right? Consensus-based decision making, and again, that collective. And so having our voices at any type of decision making table, very, very much. Our foundation is built on the nothing about us without us concept for sure, and that people who use drugs should be not just around being advisors or validators or anything, but that we will be, you know, forefront and leading the initiatives that, you know, affect our lives. And so, you know, I think it's the liberation of drug users is at its time, and that we need to continue on. And our allies are very, very important. But to speak really quick on allies and self-identified allyship, which to me has been like, we see a lot of people coming out of the woodwork. There's a lot of money, and well, not enough money involved, but there's money involved around our lives. And so having self-proclaimed allies come forward and experts, including some that have exploited us in the past, tokenized us, and then coming to work alongside us. And it has to be spoken about. It has to be, we can't, you know, create new ideas and on old wounds. We can't move forward with a lot of this stuff. And it has been very true for people who use drugs, that we've been treated poorly in healthcare systems, in of course the criminal justice system, which and socially, and the social community violence that we've endured, systemic violence that we've endured. So we speak that truth, and that's what we continue. So we have a lovely space in New West, which is for the provincial group. We've acquired technology so that we can continue on meeting together, especially with our provincial groups that are in each of our region.
We've launched new social media channels.
Yes.
You can find us at BC, our acronym basically, yes. at all of the different social media sites.
Yes.
So it's also on our website, which is just the acronym again.
Yeah, so come and check it out, and definitely get a hold of us. We want to partner with our allies, and when we say our allies, they're the people that we've determined that have been with us before money was involved. You know, this group had been doing this work for 10 years without any funds, you know, basically piece little chips Hep C grants, or, you know, that patchwork funding that we've had to do on our own, and it's been a lot of volunteer time over a decade, and then we were able to get funding finally for moving forward for the work that we do. We've definitely, when I listen to all the presentations and knowing what we know, so for one, with the drug market, for sure, we see our quality of drugs go down, toxicities go up, and price go up, and that's what we see here in the Fraser for sure, because that's the area I live in and I do a lot of work. We've done some work around COVID harm reduction, COVID style, basically being able to go into places that are still having people in larger groups, let's say, where, you know, doing some education around hand washing and mask, gloves, PPE, which is another thing that we've recently been advocating for, is that many of our peer workers are frontline and essential workers, but we've been told we're not in many cases. And so when we're out there not having access to PPE to continue the work that we do safely, has been a challenge. I could probably sit on here and talk for hours and hours, for those that know me, of the dynamics for people who use substances right now and what has been happening with COVID. I think that a lot of we did an open letter and a press conference to Bonnie Henry early on around the testing priorities. We had concerns around the prison population. We had concerns around, you know, downtown East Side. We were saying around having people hooked in with hotels and a prescriber and all of this at the very, very beginning. And a lot of that has shifted now, which is good to hear. I think it was almost immediately the next day that a lot of these concerns were addressed. Partially our Indigenous people weren't even looked at. And when we looked at how Canada and the provinces were able to priority test, it was all different. And so, you know, really wondering how people choose priority testing and why it's different per province, and why we didn't see our Indigenous people, our prison population, and our shelters in downtown core that we knew could be potential clusters. They had clusters on there, but more of a reactive instead of a preventative. We have a women's advocacy project coming up. So we received $25,000 for a gender-based initiative around the overdose and women. And so we chose around, for many of us that with lived experience around the apprehension of our children, and what I consider the most violent of all systemic acts, and deeply rooted in colonization as well, and overrepresentative of our Indigenous population, where we are able to have peer-to-peer train-the-trainer model for women that have gone through this system, that have gone through child apprehension, that have maybe got the children back, maybe not, being trained to do advocacy for women who are going through that, and to provide that support, that healing piece, that emotional piece that many of us have never had the chance to have that while we've had our children taken out of our arms in hospitals, from our homes. And so this is really something that's very important to those of us with lived experience as women and substance users, that this practice stop. And that we're able to be there to support other women, to advocate, and if anything, walk through that very, very horrible, horrific practice that needs to end. And so we have that $25,000. We're working with Susan Boyd, Jade Boyd, and Jen Conway Brown, and the rest of us here that work here, we're of lived experience. And so we create a lot of the curriculum ourselves for us based on our extensive knowledge and experience, and our collective knowledge and experience. So we're really excited to get that one out, so that we're able to go back into our communities. So every drug user group could send to experts that this is their passion, this is what they want to do with work with women, mothers, and substance, and do the training, return back to their communities, and be able to train a few women in their community to hold that area, that issue of systemic violence based on mothering and surveillance of women who use drugs and parent. So that one is a big curriculum that we're looking for, and that's the education piece that we can share with other groups, and that's what we hope as well, that our member groups have access to, whether it be safe injection, assisted injection, that advocacy piece, they have access to it. We also, I was thinking about the dark web. I think it would be really important to have peer support in that. It's probably going to die soon. I'm probably going to have to plug you in. So we have a few words to say about that. When I was listening to, I'm sorry, and I can't remember, is it Glenn from Oregon? Amazing presentation, but way above the digital divide, I call it, you know, I have a hard time with Twitter, never mind, you know, the dark web. I have gone on it one time, and definitely it would be great to have someone experienced with that to show those of us, and if there was any way that could benefit. I often find that since the dark web had come up, and fentanyl and carfentanil, that we used to call it organized crime, and I call it disorganized crime now, because I find that people who are able to do that may be able to navigate the dark web quite well, however, may not have much experience around substances. And so they go and purchase these drugs thinking they're going to make a lot of money. I've seen, you know, people that get on there and, to be honest, you know, order things in, and I have concerns because it used to take, thank you very much to the war on drugs, but now it's created this niche of people being able to access it quite on their own even, and not have a huge, you know, organized syndicate to carry out the substance. And I think that is detrimental. I don't think that's a positive out of this at all. I think this is where we find more concoctions being done and people becoming their own chemists, but that's just from what we see. We're not very, many of us are not necessarily accessing the drug supply in that way for our groups, although we would like to look into it because there could be a few things that we could do. We are also involved in a safe supply initiative out here, because again, this is, you know, we didn't stand outside with a big sign saying we don't want heroin anymore, we want fentanyl. It infiltrated our supply. And, you know, and so when people say that people don't want heroin anymore, it's one of those things that it's like, but what's available? You know, this came in, infiltrated, and then it's this new generation. And if we don't stop the bleed now, you know, our children and our grandchildren are looking at having to navigate this type of system that's deadly. And it's not about addiction. Our real frustration, of course, is a contaminated supply, and then our government is answering it with more treatment and more, you know, and that has nothing to do with a tainted supply. It's two very different things. Yes, upscale treatment, make it better, easier. You know, I was part of an involuntary care research project, and we couldn't even, they wanted to know, like, when would involuntary care for primary substance use disorder be okay? And it's like, we can't even get people who want help. So why would we even go down this road of, you know, involuntary care of people who don't want it? And until we get that piece right, that shouldn't even be a conversation on the table. So that's, again, one of our frustrations. We also are going through our messaging right now of what we want to, you know, our calls to action. And really right now, looking at doctors with this COVID dual prescribing nightmare. I mean, it's great that it's put out, but to navigate it has been really tough for people. And that we want to, the messaging basically, life before license, and having our doctors understand that this isn't a time to, you know, have to worry about being threatened for their license or the college, and so doing that work as well, advocacy around that. But I'd be happy to take any questions. I can, you know, take you guys for a little virtual tour. No, our space has been really great to have in New West. So it's not in Vancouver. We're right by the SkyTrain, so we are able to invite more people inside.
Thank you, Erica, and thank you for speaking to women's issues like so poignantly. We don't often hear that aspect, and I very much appreciated you talking about that, and about women losing their children to this, because it is such a an atrocity that happens and a harm to people that a lot of people don't recognize until it happens to themselves, right?
Yeah.
So I think we'll move on with a couple of questions here, and I want to keep in mind that I'd like to have a person who has lived experience ask a question, as well as somebody who doesn't, for Erica, so that we have another speaker after this. And I just want to make sure we're being inclusive of our. Running.
I hope my phone doesn't die.
Well, it doesn't look like we have any questions right now, Erica, but you're going to stick around until the end, so that at the end, when we do the Q&A, people can ask questions.
Someone's not people with lived experience. Okay. Yeah.
Thanks, guys.
Okay, so I will introduce our next speaker. And our next speaker is Frank Critchlow. He has been a harm reduction worker for over 12 years with Counterfeit Harm Reduction Program at the South Riverdale Community Health Center. In his role at Counterfeit, he provides both on and off-site harm reduction education, referrals, and distribution. Frank has worked with both South Riverdale Community Health Center's Safe Consumption Services, Keep 6, and volunteered at the Toronto Overdose Prevention site at both the Moss Park and Parkdale Unsanctioned sites. Frank is also the acting president of the Canadian Association of People Who Use Drugs and a member of the City of Toronto's Confronting Anti-Black Racism Committee, the City of Toronto Drug Court Advisory, and also he is a community activist and my friend. And I am pleased to have him speak today. And he'll be speaking to issues around race and people who use drugs, especially the African, Caribbean, and Black community. So you can go ahead there, Frank. Thanks for joining us.
Thank you, Natasha. The saying goes that you always save the best for last. Can you hear me? Hello?
Yes, we can hear you.
Okay, great. Yeah, that's the saying. They always save the best for last. Thank you for inviting me to come and speak to you briefly. I know time is the essence, and this is my presentation, or my little speech will be different from the previous colleagues. I'm going to talk about how COVID-19 affects people of color, which is in the African Caribbean Black community or the African Caribbean Black community. With COVID-19, as with all health issues, there are deep inequities and disproportionate burden by race and socioeconomic status. In the US, a recent report that analyzed death from COVID-19 up to May 19 found that overall COVID-19 mortality rate for Black Americans is 2.4 times as high as the rate of white and 2.2% as high as the rate of Asians and Latinos. I'm giving you a comparison of American as opposed and also Canadian, because in Canada we don't keep stats on Black people, so to speak. Collectively, Black Americans represent 15% of the population in all areas in the US. Releasing COVID mortality data, but they have suffered 25% of the deaths. Why? African Americans have more of the underlying health conditions associated with fatality, which is heart disease, diabetes, asthma, and obesity. They're also subject to structural racism when trying to access healthcare. Okay, we don't know exactly what is happening in Canada. Public health has not yet collected race or income data on those who test positive for COVID-19, but it is likely the same story in Canada. Racism is a health issue, is a healthcare and health inequities exist. Our Chief Medical Officer of Health, Dr. Elaine de Villa, has said that the city public health units have found that people living in areas with the highest proportion of low-income earners or areas that have the highest proportion of recent immigrants and high unemployment rates experience a higher rate of both COVID-19 cases and hospitalization. Researchers at the University of Toronto pointed out that Black people tend to be employed in low-paying and care-aching jobs, including clerical positions, janitorial staff, and personal support workers and nursing assistants, who are now determined as essential services and are at a greater risk of exposure to COVID. The convergence of public health and policing to enforce group gathering and stay-at-home rules gives another reason to police Black people, who we know are already disproportionately stopped by police. It is hard to imagine that the gathering, the parks were open on the weekend in Toronto. And it is really hard to imagine that the gathering in a park called Trinity Bellwood Park, it was mostly white young people gathered by the thousands, having a good time, that would have been allowed to continue in the crowd had it had been a majority of Black or racialized people. One of the biggest challenges the African Canadian or Caribbean Black community people is faced with is not being able to go to the house of worship. This place to worship and socialize with their church brothers and sisters has been taken away from them. This is something people of color look for every weekend because they're very spiritual and religious people. Also, it has also caused us not to have family gatherings, which is big in our community. It has impacted us from sports competitions such as basketball, baseball, hockey, basketball, baseball, track and field, and football. And of course, where young Black men, this is where they go to expose their talent so to seek a future. And that has been taken away from them because of COVID-19. I'd like to end by saying, every day you look on the television, you see the Prime Minister, you see the premiers, and you see the mayor saying, we are all in it together. And I'm saying to you that the African Canadian Black community is not in it all together. Thank you.
Thank you, Frank. You're a hard person to follow, I'll tell you. Thank goodness there's no other guests. You're a very eloquent speaker. You're very good at your speaking. You and Erica both are hard people to follow. And not to say that Blue Soleil and Michael isn't, but yeah, no, thank you very much. So I wonder if anybody has a question for Frank before we move on to, we have 15 minutes left for a Q&A. We're seeing lots of great talk, Frank. Thank you, Frank. Okay, here's one. What do you think is needed to acknowledge racism in Canada? Many people in Canada say we're not racist, We are not like the US. So how do you respond to what do you think needs to be acknowledged for racism?
We have, okay, as in my bio, I mentioned sitting on a committee for anti-racism. We have to teach and educate. We have to educate Canadians, white Canadians, about racism. This is something that is lacking in our system and has to be done from the level of in school all the way up. And that is something that is lacking. And that's the only way it could be done.
Okay. And there's another question here. And it says the Black Canadian community within the context of drug policy, overrepresentation, as well as in criminal justice system and foster care is not given the same energy at all. Why is that?
That's the question I should be asking you guys. I don't know. I believe because we are underrepresented and we are the most racialized group of people. And like for instance, on this call, I'm the token on the panel. I don't know how many people of color are on the other end for this gathering, so to speak. It is something that we're not really engaged in, and we are always being left out. So how do we, my question is, how do we bridge that gap?
Very good point. And so I didn't ask a person who used drugs question or PWLE. I don't see any here. And Frank, I think you're my friend and I care about you a lot, and I try to make sure that we have you. And I'm sorry that you are the token drug user of color today, because that's not the intention. I love you, you know that. And we should have.
I have to mention it to you. I was going to do it privately, but then I said no. I have to do it in front of everybody. So next time you would only have one person of color. You have a male and a female, equity.
Yeah.
But every time I do a presentation, I'm always the only token. I'm always speaking to white audiences.
Yeah.
Okay?
And that's not okay. We need to have better representation.
Yes.
And I acknowledge that. And I think that the group, or at least I hope the group hears that and understands that we need to be more representative.
Thank you.
Okay, so here's a question from a person with lived experience, and then we'll go to the full Q&A. So how can we empower people of color to engage within this work?
How can we, okay, as I said, okay, first of all, to do it, we have to get all levels of government on the same page. We need funding to do it. Without funding, it's impossible. Nothing could be done. Okay, that's the way I look at it. Whenever we talk about funding, we always talk about funding for injection drug users. We don't talk injection drug users. We're talking about white people. We don't talk about people of color. People of color, most of their drug use is crack, smoking crack. So we always tend to be, left out from everything.
All right, so thank you very much, Frank, for your educating us all. I think we all need to hear you and hear what you're saying loud, because I think we all need to do better when it comes to people of color. And I recognize that, and I want you to know that I recognize that. So I believe, let me find my agenda. I have so many computer screens and papers in front of me. I've lost my space. Okay.
Natasha,
Thank you.
Do you need a hand from me?
I'm just getting down to the end of the agenda here. So, question from the floor. Do we have questions for the floor for any of the speakers? Or for all of,
Yeah, people are allowed to put up their hands now if they want. If not, we will go to the ones we already have in stock, and only those, I guess. No, if nobody wants to talk, that's okay too.
Is everyone aware of how the raise hand function works in Zoom? It might be a little confusing if you haven't done it before. Shay, do you want to explain that? Actually, because I don't know it off the top of my head either.
Are you talking about this one?
No.
Yeah,
well,
I think there's an actual function though.
There's a function. So there's two ways. One of the easiest ways is in a Windows environment to select Alt and Y, as in, yes, put my hand up. And then Alt and Y to take it down. In a Mac, it's Option and Y. The other way to do this is Open Participants, which is an option at the bottom of the screen. And then in the right-hand corner of that, you can put up, it says raise hand. And it looks like Tom now has actually raised his hand. So good job. If it's okay with you, Natasha, do you want me to just unmute Tom? Okay.
Yeah, I'm muted.
I'm trying. There.
Do I have to unmute myself?
No, you're there now, Tom.
Both of us have to. There you go.
Okay. Good afternoon, everyone. I'm a grateful recovering alcoholic and addict, sober only by the grace of God. My name's Tom. It's good to be here. I'd like to thank all the speakers. Very well informed. But I think from my perspective, being clean now for 12 years and being an ex-drug dealer and all that stuff, that's just my opinion. The drug dealers are not concerned about the people that are using the drugs. They're just concerned about multiplying whatever it is they're putting on the street and getting the money. They're not concerned about the lives and the people that are dying. And that's the sad part of it all. Because when a drug addict like myself was sick and I was given something, I didn't care what was in it. I just wanted to get it in me to make me feel better. And today, with what they're putting in drugs, a lot of brothers and sisters are dying because of the poisons that are being put in the drugs that they think that they're buying. And it's really, really sad. And I just hope through all these different organizations that are coming together around Canada, regardless of what color they are, that we can become a strong group and advocate on behalf of the drug using people and do for them what they're not capable of doing for themselves. And I think we're on the right track. I just think that we need more support from the government and more money and more agencies opened up all across Canada and the States, because this is happening worldwide, not just here in Canada. And I just like to thank you for giving me the opportunity to put my 2 cents worth in there as a recovering person with lived experience who lost a daughter due to an overdose, who has a son right now up on attempted murder charges due to drugs. And if it doesn't get you one way, it'll get you another. Anyway, it's good to be here, and thank you all for sharing your experience, strength, and hope with me. I learned a lot here today.
Thanks, Tom, and thank you for sharing a little bit about your personal life, and especially about Natasha, whom I loved and was a very good friend of mine and missed very much every day. So yes, thank you for mentioning her and for sharing your perspective. Okay, you touched my soul there for a moment, Tom. I got tears in my eyes.
I just had a phone call come in, so
okay.
Sorry about that.
That's okay. You take care, Tom. Speakers. So let's see here. There's so many questions. Raise your hand. Okay, here's one from a person with lived experience. Again, sorry, I'm not following my own rule of doing one after one lived experience, one not, but anyway. Why doesn't Canada collect racial income data on COVID and other issues? And how can we advocate for that to change? If we don't have data, it's easy for government and organizations to ignore racism. So could you speak to that perhaps? Frank, do you know why that is? Has there been any talk about that?
Okay, this is something that, okay, it's a very good question. I've been advocating for this for quite some time, but I haven't gotten very far. I'm just one individual. Where I work is I work with mostly white people, and one of the problems that I can see is that the Black race is very dysfunctional. In all honesty, it's very dysfunctional. And why it's dysfunctional? It's because of colonialization. Slavery caused us to be very dysfunctional. We haven't gotten over that as yet. Okay, it's going to take a long time for us to overcome those hurdles. And this is the only thing, I can see that, we have to try and educate the youths of today, not only Black youths, but brown youths and white youths, teach them about racism. And then, we have to force governments to start collecting data on people of color.
Okay, thank you. I see a question up here as well. And I guess I'll pose this to Erica, if Erica is there. So it says, what do you see as the role of journalists in promoting the needs of people who use drugs, people with lived experience, and people who are working alongside populations of people on the front lines? In a smaller local, I'm a small local reporter, but I'm curious to know what people suggest.
Oh, it's your absolute, unmute.
You're unmuted.
I'm unmuted?
Yep, you're good.
Okay. Keep saying the host would like to unmute you. Okay. If you can hear me, really important. I think that's why with the press conference right away that we did, and we've often gone to, if anybody had seen Dr. Farley's interview with the jail about the jails, and like Twitter's amazing to get some things out. And I think through Twitter, connecting with journalists that way has been beneficial to us. Garth Mullins and his Crackdown podcast, which is journalism to me, and very much so for advocacy, used as advocacy is very important. You can do education through this. If we look at the demographic that still is, reading articles and writing in the paper, even at the hyper local level community, I think it's very important. We got a lot of we got a lot of recognition of what an organized drug user group is, because I think people had some different ideas of what that looked like, and having an ally in a reporter that's going to step up and be able to take down. And here we have this chance to use our voice collectively, and many of us have already had the cost of disclosure, have already had the cost of disclosure where we have nothing else to lose, many of us, and so we need our voices to be heard, and many of us that also haven't necessarily our disclosure wasn't under was under our control, and have come forward and identified as people with living experience, that having that and a journalist to take that voice is so very important. And it's amazing what a little bit of publicity or having our stories being told in those different avenues is very important. And I think by reaching out again to your local drug user organization, because we've got lots of them, and we're more and more are coming out and being supported in communities, is to start there. I think that way you have the voices of diversity. Oftentimes many of our most marginalized are at the forefront, but that's because for many of us, if we meet the needs of our most marginalized, vulnerable people, and I use the term vulnerable as in, it's not people aren't vulnerable, it's the system that makes them vulnerable. They can have vulnerabilities, yes, but again, not having determinants of health met, having basic needs, human rights not met. And so our most marginalized people, when we meet those needs, everyone benefits. And so those are the messaging that we need to get out. And when things happen right away, see, this is the thing that's really hard, is disseminating that information when a human rights violation has occurred like daily, multiple times for people who use substances, and then being able to have a place where we could tell that truth and have it put forward is very, very important. So I would say reach out to your local drug user group if you have it, and ask people who use substances how would they like their stories or their issues presented. And I think it's very, very important for our allies to walk with us, not ahead or even behind. And I think people get really people with non-lived experience often get, I think, intimidated or uncomfortable, because it's always these like microaggressions everyone is so concerned about. And I'm sorry, but we need to start looking at the macro all the time, and we get really caught up in these micro. And I think it's it's a disservice to us when we need to focus on these larger issues.
Thank you, Erica.
Yeah.
So I realize we are at just about 1 minute to end time, but so I want to thank everybody on behalf of the Canadian Drug Policy Coalition, on behalf of CAPUD, and as well as AIDQ for coming. Thank you, Michael Gilbert and Julie Soleil, Erica Thompson and Frank Critchlow, for taking the time to share your very sometimes personal stories. I think people learn from that, and thank you very much. So I guess that's the end of Stimulus Connect 2. You know how to reach everybody on the Canadian Drug Policy Coalition website to find resources that are going to be out from today. We'll make sure to send out the survey link to people that wanted to see the survey and the follow-up paper. And everybody take care, and thank you for joining us. And I think Shay has a word. I see her hand up. Go ahead.
The next Stimulus Connect is going to be coordinated with the Canadian Students for Sensible Drug Policy. And of course, June is Support Don't Punish Month. So that's your tick on what it's going to be. Thanks, everybody. We're going to post the questions and answers on the Stimulus website.
All right. Thank you, everybody.
Thank you.
Oh, and Stephanie, if you want to say goodbye too, say goodbye.
No, just thank you, everybody. I think this was a great experience for all. I think we all learned a lot.
All right. Bye.
Bye.